Good evening. My name is Mason West, and I'm the president of the Illinois chapter of the National Association for Black Physical Therapists, or NABPT, bringing you what I believe will be a great discussion. But first, what is the NABPT? The vision is to be a catalyst for change and inclusion, encourage, promote visibility in professional associations and leadership positions in the physical therapy field. We hope to do this by compiling a national directory connecting Black physical therapists to other healthcare providers, enhance membership opportunities, professional networking, community service opportunities, and a general referral web to catalyze career development for Black physical therapists and other healthcare professions in the way of research opportunities, continuing education, leadership skills, focusing on combating health disparities in the Black community, to promote and increase recruitment and retention of Black healthcare providers and applicants in various programs. I am joined by Cohen Brown, who works with me at Team Rehabilitation, different clinic. CB, give a little introduction if you could.
Yeah, absolutely. Thanks, Mason. So my name is Kawan Brown. I go by CB in the clinic. It's just a little easier for people as far as retention goes. But I am a clinic director and I'm a mentor for Team Rehab in Lyle, Naperville, but I kind of help out clinics in the western suburbs as well too. I've been a physical therapist for about 7 years now, and I have a high passion. One, just working with all people in general, but specialized kind of in the sports medicine rehab, just like Mason. I steal a lot of his ideas, actually. Other than that, I love the idea of just kind of giving back to the community. I grew up on the south side of Chicago, so I was surrounded by a lot of brown and Black people my whole life, and just kind of seeing situations and the lack of awareness in those areas of what physical therapy is, what Black people in healthcare, what that means and how do we get there, I think is underrepresented. And I just love the platform that we have here to get to that next level.
And of course, the man of the hour, Dr. Joseph Wilson. He is a skilled foot and ankle surgeon with extensive training in all aspects of foot and ankle care, with subspecialty interest in trauma, sports medicine, and complex foot and ankle reconstruction. He earned his undergraduate degree from Northwestern University in Evanston, Illinois, and then obtained his doctorate of podiatric medicine from Rosalind Franklin University School College of Podiatric Medicine in North Chicago, Illinois in 2017. He then completed his podiatric medicine and surgical residency training at Mercy Hospital and Medical Center in Chicago, Illinois, where he was most notably chief resident during his final year. One thing I thought was really cool that I snagged from his bio was that he was introduced to his specialty from his mother at a young age, and thus treats all his patients with the same amount of love, respect, and innovative compassion care as he would his family. I mean, if you can't, you treat your family well, get out of the field, right? So Dr. Wilson, how are you doing this evening?
Good. First of all, I just want to say thank you so much, Mason, for hosting this as part of the NABPT as well. It's an honor to be able to talk, just to get to know each other and see, because I think we all have shared passions. We're African Americans in healthcare, and to be honest, we look around and there's very few of us, especially up here in the Chicagoland area. Thanks for the opportunity. I will say thanks for the introduction too as well. I remember last time when we talked, we were saying, he had asked me a couple of questions and I was like, you know what, I'm still in this, I'm still figuring it all out. And so, where I am today, it's, been obviously by God's grace, a lot of hard work, a lot of opportunities that I'm very blessed and grateful for. And all that. So, just since you already mentioned a little bit about me, so I was born in Canada. My parents are actually originally from Ghana, and then we moved here since I've been 5 years old. So, CB, and I lived in Aurora for a little bit, and then grew up in Naperville. And so CB had mentioned that you grew up in the South Side, where there's quite a lot more representation down there. But actually, believe it or not, with me and my family, my siblings, when we're growing up in school, there's pretty common to be the only one or very few of us in our class all through grade school, middle school, a little bit more diversity, obviously in high school, and then different ball game and undergrad. But yeah, it's just very interesting in terms of that dynamic there. But yeah, I've been fortunate. I've been able to do all my training and education here in the Chicagoland area. And it's just been such a good blessing now, and just being able to reach out and help patients of all backgrounds in the community on a daily basis.
So at what point in, whether it was undergrad, medical school, residency, et cetera, did you realize you wanted to work in the specialization you're in? And then kind of walk us through what a typical day might look like for you.
Sure, absolutely. So how I got interested in podiatry was actually because my mom, there's 5 kids of us, so she was always active, taking care of us, working a job too as well, and we had our grandparents living with us when we were growing up, and so you know, she was always on her feet, and so she actually developed some foot conditions, foot pain, and I guess I can be a little bit more specific, but posterior tibial tendonitis, but and then she had like some corns and calluses or things that for some reason I thought were very interesting in terms of it didn't gross me out, whereas my other siblings were like, oh yeah, the feet, yeah, I don't want to touch the feet or whatnot. But for me, it was that kind of piqued my initial interest all the way through grade school and middle school. I knew I wanted to do something in medicine. I remember 8th day career day actually was the first time, because my oldest brother's friend was actually in podiatry school or planned to go to podiatry school as well. So that was just always on my radar. I was like, oh, that might be something I might be interested in. So I knew I wanted to do that or orthopedics or something foot and ankle related. And then fast forward to high school, shadowed a bunch of different specialties, ER, cardiothoracic surgery, a few other specialties, and in undergrad, I went the pre-med route, and this kind of this ended up fitting the bill because I knew I wanted to do surgery. Didn't want to do all day, everyday surgery, but I wanted to have a good balance of surgery. I love just being able to focus on all aspects of foot and ankle versus just a certain part of the body or certain body system or certain organs. And so, yeah, that's kind of what piqued my interest, and I never really looked back. I will say one thing I will say is, especially when it came down to applications my junior year, my parents were like, well, you should still apply to, because it's a little different in terms of schooling, but you should still apply to allopathic medical school. And so I filled out all the application and everything, and I was, because you had to have a personal statement, so I wrote down my personal statement from there, and then my personal statement specifically more tailored towards podiatry, and I emailed it to my family to kind of proofread, and they're like, yeah, you can tell that you have a passion for this, and they're very supportive, and haven't looked back since then. So, oh, you'd asked typical day. So at this point, my schedules, so I work Mondays 10 to 7 in our Crystal Lake office. And so I see patients up there. Tuesdays 8 to 4. Wednesdays as well in the Hoffman Estates office 8 to 4. And then Thursday mornings is my surgery time. Then in the afternoon, I'm in the wound care center too as well. And then Friday all day in the office, and then one Saturday a month. So I'm up early. It's always a fast moving environment, and it's pretty cool. It's pretty cool what I do.
That's awesome. Yeah, no, I think so. Thanks for sharing that. I think it's always helpful to kind of see where you came from, what your passion was, and how you developed that passion, and what kind of support you had along the way to get you there. So that's really cool. Thanks for sharing that. So as you mentioned already, growing up in Naperville, where the demographics are just a little different, and you were amongst a lot of mainly the mainstream kind of white middle class, upper class, white people. did you experience, like, any time during your class, have you experienced or witnessed, any kind of racial biases or discrimination as your time as, growing up, or even as a student getting into some of the medical program and undergrad?
Yeah, I mean that's a great question. It's obviously a different environment, let's put it that way. And so in my case, just a little bit more background, my parents, as I mentioned, were from Ghana. And so for my father, when he came first to Canada and then to the United States, got his MBA in as well. Education was a big thing, is a big part of it. And so when we grew up, luckily we had a very close-knit family. I'm very close with my siblings and all that. There's 5 of us. And so so we stuck together, and I have a twin sister too as well. And so we kind of had initially, some of the same classes when we're going out, and so we can still relate on different levels and all that. One thing I will say that I have noticed, not only through that, but just in life in general, when we talk about family, in terms of family isn't necessarily your same blood. I don't know the best way to say it, but sometimes you have friends or mentors or people that are so close to you that aren't your same race, the same color, don't same belief systems or whatnot, but they're your closest friends through some of the hard times you have in life and all that. And so I'm one of those things where, believe it or not, the fact that I grew up more in a, I guess, predominantly white, and then even in high school there was some, I guess, Asians and Indians too as well. That gave me more appreciation or more of a background, so that now today when I'm practicing, I can actually relate to a lot of those people a lot more than I would have been than if I was in a completely, I guess, or mostly predominantly African American setting. And so I always look at the positives there. Are you going to face, discrimination or things during school? Yeah, I mean, we are. If anyone were to say that they didn't face anything in school, they're probably just either, I don't know. I mean, yeah, either they didn't go through the same school system, or they're straight up lying to you. But that being said, I'm one of those people that I worked hard. I'm more of the mentality of quiet confidence, meaning just do what you got to do. I know when I was, I was one of those people. I never really had a chip in my shoulder. I would just, if someone says something, I still do the best I can. At this point, I'm very good about just let it slide off my back, and that's served me pretty well. I, pick and choose, let's put it this way, which battles to fight. But that being said, yeah, I mean, quiet confidence, meaning I study and do the best I can, and I don't let what others try or think about me try to affect how I'm doing it. It's obviously easier said than done, but that's yeah, that's been my experience thus far.
Yeah, I like what you said there about how your previous experiences dealing with other races really helped you, so that you can do that now. I feel the same way, growing up in Northbrook, Illinois, which is not diverse whatsoever. Yeah. It made it very easy. Then when I went to, Trinity College out in Connecticut, which again, not very diverse, same thing where I'm at in Barrington currently. And so it's being able to speak almost multiple languages, but still be you, right? Still be confident in who you are. And so I really appreciate you saying what you did. One thing you also mentioned was how your family may not necessarily be your blood, and and how mentorship is so important. Did you happen to have a African American mentor in the field or anything like that helped you assist you in that transition? And if you didn't, would you almost wish you did at some point in order to show the pathway for someone that, like, again, more like correlating this maybe to how the world might see you?
Yeah, absolutely. So especially, I don't know if The way it worked out, I don't know how it worked out. When I applied in my particular class in medical school, I was the only African American. There's a couple above me and a few below me, which, over time I still reach out and mentor a couple of them as well. And so, and then the way it's structured, the first 2 years, you're all kind of coursework, and then the last 2 years is your clinicals. And so you're kind of away from campus. So I didn't get a chance to connect with those above me as much as I probably could have. But that being said, there's definitely a couple of professors professors both in the clinical setting as well as the academic classroom setting that I was able to reach out to, that basically just took me under their wings, and went to shadow in their office a couple times when I was a student, and kind of got a better understanding, a better picture of our profession, where things are going. And over the past, just the nature of our profession in terms of what we can do in terms of surgery and all that, and training styles, have evolved tremendously over the past 20 or so years. And so they're looking to us as the newer, I guess, quote unquote, younger generation to really push the field forward, let's put it that way. And so got a lot of good mentorship that way, and it's been valuable there. And kind of like I mentioned too, even like we're talking about all families and all your blood, meaning I've had a lot of really good non-African American mentors too along the way. And even now where I'm at, I'm fortunate to be part of a bigger group with multiple doctors. And so if I come across like a case or a certain situation I haven't necessarily come across before, I can always reach out. And there's a lot of really good mentorship to say, hey, well, maybe try it this way. Or because a lot of times, they're like, I've been there before. I've been there before. And it's really great to have that resource to be able to bounce off ideas and to get better. Because at the end of the day, as I was telling you, still figuring it all out. I don't have all the answers. I don't think anyone will ever have all the answers, but being able to adapt, learn from others, and having good mentors goes a really long way.
No, that's awesome. Yeah, I think that's one thing that being able to get back to people and our community, and trying to find ways to expand our network and letting people know that they can, right? I think that's one big thing that I noticed across the Chicagoland areas. There seems to be like a confidence piece when it comes down to can I become a doctor? Can I become a physical therapist? Can I
Absolutely.
enter the world of healthcare? What would you say like would be one of your biggest pieces of advice for someone who just kind of has that that attitude? Definitely, I remember when I was going from a significantly a drastically Black neighborhood to a white neighborhood at North Central College, where I went to undergrad. It was a culture shock for me, and I kind of immediately put myself in a place of inferiority. Saying like, man, I don't know if I'm like good enough for this. I've never really been exposed to white people, and when I have, automatically kind of felt like I was a little inferior. But it took a little while. Like, took mentorship. It took some religion and things like that to kind of help me get to that point where I feel like I am good enough. And what kind of advice would you give to someone that maybe struggle with the inferior complex or confidence issue?
Yeah, that's a great question. In your case, what I will mention is that with all these colleges across the board, first of all, congratulations, North Central College. It's my parents' backyard essentially in Naperville, and so in order to be able to make it to such a good college from the get-go, that means you're already good enough. Meaning the one of these things that I always say is I guess awkwardness, or in this case we'll say inferiority complex, it's all what you make of it. It's all in your mind. Life can be as awkward as you make it, or as inferior as you make it. And so kind of like what you're saying, if you go in with that mindset feeling that you're the underdog or in fear or whatnot, it can for sure kind of change your outlook on things. And sometimes you might feel like everyone's, I don't say out against you, but you just don't know the waters. And so it definitely is, as you're saying, definitely it is a culture shock. But what I will say is embracing, actually taking that and embracing it. And so it's one strategy that a lot of people or some people have done in the past is, well, if it's, find what you're really good and passionate about. Let's put it that way. So in terms of the things that you're good at, you can, I mentioned the term early on, quiet confidence, meaning, if you're really good at, I don't know, give me an example, or if you're good at something, work at it, the fact that, so I guess once you're in a completely new environment, we look at variables that you yourself can control. You yourself can control how hard you study. You can control certain things, who you hang out with. You can control certain aspects of your life. The exam, when it comes down to it, you're going to study as hard as you can, and with a little bit of prayer, you do the best you can.
Yeah.
But what I found is that a lot of it is building relationships with people around you, and past the color aside, you can, with any person you meet, you can find some sort of commonalities. And so if we're talking about just even classwork, if you have two people don't know anyone, completely different background, but they're in the same class, they can start just building trust, building a relationship based on just the coursework alone. And believe it or not, then pretty much you find out you have the same interests. Oh, this person likes to watch basketball too, or this one loves I don't know, my favorite food or whatnot. And believe it or not, just like we're talking, your best friends, you develop the good relationships over time. And so and once you, I guess, break that mold and start making friends with other people and interacting with people out of, I guess, your comfort zone, then I believe that's a huge part of the inferiority complex. Then all of a sudden you're more confident, you're more able to be yourself, you're more able to embrace your environment. I will say also, getting involved is a huge thing, meaning I know when I was in medical school, I love, I study when I need to, but then I also like doing things outside of that. And so I was in intramural sports. I volunteered as part of like a community clinic where one day a week they would have underinsured patients come in, and we would, as students, work with the other medical students and evaluate the patient and then present the plan to the attending physician. And kind of that was really rewarding, because you're like, this is what I will be someday. It's kind of like you could already get a taste of the end goal, and it really made you feel like all the book work that you're doing is going to eventually pay it off. But interacting with people from other fields of life, whatever you love to do. Let's say you're really good at, I actually did ultimate frisbee. I'd never done it in my whole entire life, but and we just went out there, had a lot of fun. I was a free agent the first 2 seasons with my now best friend from medical school, and we first got drafted to an all-girls team, and so our record was 0-7, and then we got drafted to another team, and then by the end of the year, we actually were part of the championship team. And so we just had a lot of fun. And so, but that's really good, because you're meeting people, you're interacting with other people, you're doing things outside of just the grueling studying every day, and it actually makes you more well-rounded, kind of like what I was talking about. More people you meet from different backgrounds, once you're out as a practitioner, all of a sudden you can relate to all these people. And so now patients come in with like sports injuries or different things like that. I have yet to have an ultimate frisbee patient yet, but that's something that you can relate to. You can talk to, like, because you can actually understand. It's like, yeah, I've been there. I know how that feels. I know, and all that. And so I think that makes a huge part of it. And so I guess just don't be afraid to put yourself out there, and be the best you can be, and you'd be surprised. People, people are people are generally, most people are generally good, and they're willing to get to know you and all that.
Yeah, no, I think that's extremely important. And, you know, I think you hit it right on the head. You know, as soon as I became kind of open to my environment, open to the opportunities that were available and there for me, I met so many different types of people. I joined so many different types of, you know, groups. I surrounded like you mentioned, you know, surround yourself around things that you're interested in and that you're ready to pursue. So I, you know, I found, you know, the athletic trainers, I found the physical therapist, and I was like, you know, man, this is who I want to
Mhm.
become, and I see how they're living life. I've taken some tips from every, you know, type of person, no matter race. You know, I think that's one thing is, you know, not being resistant, like you said, to people that don't look like you. And um, like you said, most people have good intentions, right? Most people are there just are there just to want to connect and have that relation, and learn from you as well too. So that's something I realized, that a lot of people were more interested in me and my background, which I was like, this is cool. I actually get to share my culture and my background a little bit too.
Mhm.
You know, that kind of helped them out. So yeah, no, I appreciate that. And it sounds like we have to get you an ultimate frisbee patient too. So
Yeah, yeah. One thing that my parents, especially my dad, because he was in the business field too as well, because it's all, a lot of it is about appearance and how you look and all that. Because as soon as you walk in the door, or a patient walks in the door, unconsciously, based on how you're dressed, they're going to perceive you a certain way. And so, even not only that, but even through school, through all of that, dressing is something that my parents were always like, you know, you still want to look, you always want to look presentable, meaning they're like, yeah, I mean, technically, yeah, you can, I'll say this now, but they're like, yeah, you can technically go, you know, in a hoodie and to class and all that, but you're like, you're going to be a doctor someday, so start acting like it. And initially I was like, that's annoying, whatever. But then as time goes on, you know, it's something to be said about you, you know, getting up every morning, dressing up, going to the office. It just makes you have a sense of, I guess, purpose or sense of accomplishment with that. And so, and then as we all know, in terms of profiling and all that, things can happen based on how you're dressed, and the being in the wrong place or at the wrong time or things like that. And so that's always something, you know, worth mentioning too, that my parents always kind of mentioned when I was younger.
My second ACL tear was actually during ultimate frisbee. So with this weather turning, we got to find some pickup games, something like that, get
Oh yeah.
on the field.
Oh, I'm all down. Yeah, let's do
Uh,
it.
awesome. Bringing up the professionalism and appearance in the last, I believe it was in the last year, it was just
Mhm.
passed in Illinois that, you know, certain jobs can't say within their practices, right? Like you can't have braids, you can't do this, you can't do that for some of these professionals. And where do you fall when it comes to that? Because, you know, there's the true professionalism, right? Not wearing like a t-shirt to see your patient kind of a thing. And then there's the perceived professionalism where it's like,
Mhm.
well, you know, this individual might have braids or cornrows or something that falls more within the African American culture that they don't
Mhm.
perceive to fit their mold. So what would you say to like a student, someone on an internship or something, that they had a patient come to them and there's a weird interaction due to something of that nature?
Um, that's a tough question. I will say, well, this is a great question, but what I will say is, I mean, I feel like the pendulum's always changing. So I'll give you an example of tattoos, especially in the medical profession, just in general. In the past, it's been, you know, you always got to keep it covered, and you don't really want it to show because of what patients or other people may perceive. It's still very much that way, but I think it's kind of gotten changed a little bit, not as, I guess, strict, or, you know, times have changed a little bit from that standpoint. But I guess what I'll say is, you want to be who you are. You don't want to put on something that you're not. And so you know, I guess there's different, yeah, that's the best way I can there's different, I guess, perceptions of professionalism is kind of what you're saying, whether it's clean shaven or whatnot. A funny example I'll give you is so with in my case, I have a young face, so without a beard, I look like I'm 15 or 18 or whatnot. But I always grew up in a household where my parents, or especially my dad, he's always clean shaven and whatnot. So once I finally got into training, and patients were like, "Wow, how old are you?" Like, what do you know? And so I started rocking out the beard or growing out the beard, and I keep it well trimmed though, so that it still looks, I guess, professional. And even that was like, it took them a while to get adjusted to. And I was like, sorry, I'm keeping it kind of situation. So it's got to be. I'm pretty sure each employer has their own. First of all, abide by whatever rules your employer is, and then based on that, whatever you feel comfortable with or whatever defines you. I wouldn't say, completely limit yourself. I don't know if that I don't know if that answers your question, because you definitely want to express yourself, but then you don't want to. Um, I don't. Yeah, you want to express yourself. You don't want to put on something that you don't that's not you, kind of situation. You want to be even keel all across the board.
Yeah, absolutely. It's interesting. Even like a mini story on my end. Growing up, again, very white suburb. You're looking at my friends all around me, and I was like, I can't do the hairstyles you guys are doing. Like, what am I supposed to do?
Yeah.
And it was a while where I felt confident enough to be able to try some other stuff. And
Hmm.
I think it was about a month or two ago, I finally did some braids myself, did some cornrows, and I used it
Okay.
as an
Yeah.
opportunity to educate some patients, because I got some couple
Yeah.
like double takes, but for the most part, my
Yeah.
patients know me. I'm
Yeah.
a eccentric kind
Yeah.
of guy, and
Yeah.
yeah,
Hmm.
just more of an education. Like, this is where this is from. This is why I'm doing this. This is this. This is this.
Hmm.
This is this. And after that, it was great, because there was more of a better understanding, where I had this,
Hmm.
little
Hmm.
80-year-old white woman who was like, "Oh, those look so great on you." I didn't expect that to be the reaction.
Yeah.
So yeah, as long
Yeah.
as you take it and in stride, and it's great, because my
Hmm.
clinic manager is very supportive of that and very supportive of
Hmm.
what I do through this. So yeah, it's
Hmm.
you. Hopefully, you can also hitch your wagon to
Hmm.
a horse that, like I said, supports you.
Yeah.
Yeah, I think that is a big pressure, that, a lot of black men and women face is, those moments of like, how much, how much do we conform to, essentially the white society? And, if we don't, are we being compromised? Are we compromising ourselves and our ability to kind of progress our life? But I had a great mentor that kind of always challenged me with that. I struggled with that quite a bit growing up or throughout college. But he was like, be who you are, learn, adapt, and adopt from anything that you think is going to make you successful in your world, and kind of leave that white society mindset out of it. Be successful for your family, be successful for the family you want, all those those things really resonate with me to this day, when you do hear, like, I mean, we have all those microaggressions and things like that. I think people, you know I think other people want to connect with you, but have interesting ways of connecting with you. There's a lot of, black icebreakers and things like that. And, they have to see if you're cool with a joke or something like that, so
Hmm.
we hear all those things, but like I said, it doesn't necessarily bother me. It's more that it's one of those things that, like, I know this person really wants to connect with me, and this is a good opportunity for us to have this conversation and really connect. But kind of going back to like your experiences, when you did have to go on your interviews for, either like your first job, and then also going into med school, all those interviews, and making those decisions, did you feel any added pressure as being like a black male, against, like fellow white students or any other race that, did you feel or have any other pressure, like saying like, I probably need to go above and beyond to really impress them?
Um, that's a great question. One thing we've been that I mentioned before is, number one, I was the only African American in my class, so as far as I knew, I come some of the, I think when I interviewed with some of the other schools, I did see one or two African American applicants too as well, and we greeted each other, we sat down, talked for a little bit, how was your experience and all that. But I just kind of got the mindset that, where I am, it's not been easy, but it's, I've worked towards it. Um, grades are only a small, I mean, they definitely will get you in the door, but they also look at the whole package. Who are you as a person? Because, just like if you're hiring someone for a job, what's on paper is completely different than when you actually see the person. And so, um, you know, kind of just, we'd mentioned this, kind of just getting to the point where you believe in yourself and believe that you worked hard, and just do the best you can and just be yourself. Meaning, once you go to those interviews, you obviously want to, I mean, you answer the questions, you do everything, but just at the end of the day, they're looking to see who you are as a person and who you are as and how you'll fit into that either academic program or into the job setting or whatnot. And so if what's on paper is different, or what you express is different than if you put on a facade, and then once you actually start the job or whatnot, then they're like, I don't know about this kind of situation. And so don't be afraid to be you, but kind of just have the mindset that you've been this far, meaning I've been through high school, undergrad, medical school, through a bunch of what do you call it, training programs. At this point, exam after exam after exam, got to a point where, and this is where, family comes in, and people that are around you are really kind of encouraging and saying, hey, keep going. Because, you're, no matter what aspect of life you are, you may not get your dream job, or something may not, pan out the way that you necessarily want it to go. But a lot of times because of our mindset, where there's, as you're kind of saying, there's a lot of pressure to succeed because you're, the only one in that field that you know of, and so you're hard on yourself for things that may not necessarily go your way, and which it shouldn't be. And that's where family and friends, they look on the outside and say they're your biggest cheerleaders. Like, you made it thus far, stick it through, you got this, and they're helping you. Hey, have you looked at this job, or have you looked at this program, or things like that. And I have to say, especially my parents, my family, my dad has been really good about that. My older brother and other like really close people that you confide in, they're like, yeah, okay, well, maybe they're there through the darkest moments, and they're there through your shining moments too as well. And so once you get to a point where you've done the best you can, you studied as hard as you can, you've been a part of the community, you've done everything to put you in the right steps to succeed in the field that you want to go into, then at that point, it's all in God's hands. You do the best you can, and then prepare for the interviews, and just be yourself is what I say. Don't put on a fake show. Just be yourself, and yeah, you'll do well.
Yeah, no, I think that's a really good message, for, a lot of young people that's interested or has any interest in the medical field, but are just almost lacking that confidence. I think hearing from someone like you who's obviously successful, and you worked really hard to get to the point where you are now today. I think it shows that, by being, like you mentioned, just being prepared, doing everything you can to prepare yourself, whether, that's, studying, seeking out help, seeking out mentorship, seeking out, anything that you can, any resource that you have available to you to help you get to that point, and just being prepared for the moment, can, overcome that interview process, and, kind of take out those inferiority complexes that we experience when trying to apply for these positions. So yeah, no, I appreciate that.
Yeah.
All right, I don't want to keep you too much longer. You know, we were joking earlier. We got a Bulls-Bucks game to watch, or at least I do. What would you say was the hardest part of your journey? And then, if you go back and tell 18-year-old Dr. Wilson anything, without the butterfly effects ruining everything down the road,
Yeah,
what would
yeah.
it be?
So I'll start with the, if you could tell yourself anything, what would it be? Um, Stick with it. And that, as cliche as that may seem, I'll say stick with it, because there's times when initially, well, let's just say, we'll just use the example of ultimate frisbee. You've never tried before. You're like, well, you look at some YouTube videos, you look at, oh, okay, your interest is piqued in it, and then you're like, well, should I try it out? And then, believe it or not, then you end up maybe saying, oh, signing up for the roster. Let me go to a couple of practice sessions. So how does that relate? So let's say you're 5, 10 years old in school, whatnot, and career day comes around, and you see a professional, and they're like, oh, that kind of sounds like a cool job. I want to be a physical therapist. I want to be a physician. I want to be something, a nurse or something in the healthcare field. So it's kind of the things where you kind of pique your interest, and then once you have a goal in mind, work towards it. And so those one of those things where you're always going to have setbacks along the way. Meaning, and that's a thing I kind of mentioned earlier, is that we're all, once you're a professional, whether you're especially in the healthcare field, you've gone through so much to get where you are. You're already a lot of times you already have a competitive personality to begin with. You're always wanting to be the best you can, whether it's with grades, whether it's with school activity, whatever it may be. And so once things don't go as well, let's just say it's one class that's tough. I remember organic chemistry in undergrad. I still to this day remember the final exam right before winter break. It was literally the hardest exam I've ever taken in my life. I just pretty much walked out there, and I was like, I was like pretty much just crying. I'm like, well, that's it. Kind of you kind of get in the dumps, and you kind of you think, oh, when it rains, it all pours. I'm never gonna make it. That I'm just it's just too hard, and you're ready to give up. But what I'd say is stick with it. Meaning, if it was all easy, then it's not worth doing. Let's put it that way. And if it's all easy, you actually learn the most from your mistakes. You learn the most from your lowest moments. You learn the most from bouncing back. And that's one thing that's taught me through this journey, is it's always something new. It's always something that you're working towards. There's always going to be things that you just, as I was saying, may not necessarily go your way or whatnot. But as long as you have the bigger picture, the bigger goal in mind, saying, I want to be out there. I want to be able to have a career profession where I'm helping people every day, or I want to be able to reach out to the community. I want to be able to encourage others. I want to be able to provide healing for those that in need or whatnot. Once you have that, that's something that kind of motivates you every day. If you at the end of the day, if it's a stressful day, terrible day, everything just fell apart, and you just come home and you're exhausted, and sleep for a few hours or whatnot, and then it kind of resets. Each day is a new day, and kind of just have that mindset, and learn from the past, and just stick with it, keep going, don't give up, and that the hardest part of your journey, uh, it's realizing that, I kind of already touched on this, is realizing that there's always going to be ups and downs throughout the journey, and it's sometimes it may be hard for you to feel like you can bounce back, but that's where we were talking about in terms of support system, whether it's family, it's friends, it's church, or group of people that you hang out with. That's where they're your biggest cheerleaders, and they'll help you along the way. And so it's one of these things where I am today, I would never necessarily want to go back to school, for sure. Definitely not. There's just a lot of steps along the way. There's a lot of things you just, I guess, boxes you got to check along the way to become professional that you are today. But you can do it. If I can do it, if we can do it, it's not easy, but you can definitely do it. You can definitely do it. And yeah, all I would say is don't let color discourage you. Don't let the people around you discourage you. You're always gonna find. This is actually my mom always used to say, or she always says, surround yourself with positive people, because you're always going to come across people that are always negative, always looking to this and that, and are quick to point at your faults, or point at the worst part about the situation. And then there's other people that are a lot more positive. Well, hey, maybe you didn't succeed this way, but this is a great learning experience for the next step. Or they're always kind of more positive, and those are the people that you want to surround yourself with, or the mentors that you have that they've been there, and they're like, yeah, I know how that feels. I know how it feels, and are able to kind of give you advice and carry you all the way through. And so that would probably be the advice that I have for myself, is stick with it. There's going to be up and downs. It's not easy, but stick with it.
CB, you got anything else before we get out of here?
No, I had a great time. Thank you, Dr. Wilson. It's been awesome. Kind of hearing your testament, kind of where you came from, and how you got to where you go. Great advice. It's simple. Like I said, it's simple as it sounds, of saying stick with it. I think it's a much stronger, those three words are just, much stronger than just the actual phrase. So, stick with it. You can do it. All those things, surround yourself with positive people. All of those are great, tidbits that we can all take back to, not just our professions, but our communities, and, kind of have those as a focal point of our message. So I appreciate it.
Yeah, I mean, throughout life, we all have goals, whether it's short-term goals like, I want a brand new car, or long-term goals, in 5 years, I want to be, have a family, or in 5 years, I want to be, the head of XYZ organization, or whatever the goal is. It's different for everyone. But that's where I'm saying at some point it's worth just sitting down and seeing, just having a heart to heart with yourself and saying, where do I see myself? Where do I want to go? And then once you have that kind of that end goal, write it on a post-it note, and an example I'll give is, so my older brother, he with school and all that, we all accrue a good amount of student debt. And so one of his biggest things, especially right before and after he got married, is like, I want to get rid of all that debt. And so he put it on a post-it note. He's like, I want to be debt free. And so having that big goal there, then you have little goals along the way that you work towards, and you're, as long as you have that bigger picture in mind, kind of motivates you to keep going through the lows, because you're going to have highs and lows along the way. And so if you want to be a healthcare professional, if you want to be, obviously where we're at, we all want to be the best we can be in our profession, the best therapist, the best physician, the best, the best you can be at our field. And so you're always learning, you're always going to conferences, you're always talking to people in your profession, you're always I learn from my patients every single day. As I said before, I have two patients can have the same exact pathology but respond completely different to the same treatment plan. And so everyone, it's never a cookie cutter situation. You tailor the treatment plan to each person, because everyone is unique. We're all unique, we're all different. And so if you know that you're different, you're unique, and you're unique, you should actually embrace it and not feel inferior about it. Just embrace it, embrace who you are, and keep your dreams close to your heart, and work for them. And before you know it, you'll be there.
Thank you, Dr. Wilson. I think there's something pretty powerful about having three Black healthcare providers all sitting here chatting. I think it's really cool. I'm glad I got to be a part of an opportunity like this, and hopefully we get to do more stuff like this in the future.
Absolutely.
If someone's watching this and they want, hey, I need this ultimate frisbee playing, family loving podiatrist to take a look at my foot, what's the best way to get a hold of you and have you take a look at them?
Best way, email. You can forward my email. It's drwilson@illinoisfoot.com. And yeah, just hit me up. I am not as big on social media, but hit me up through email. It's the best way to I'll get back to you pretty quickly, and then we'll go from there.
All right, that's it. That's all I got for today. Hopefully everyone enjoyed this talk. And hey, if you're in the area and you need your foot, ankle looked at, this is the guy to go to, hands down.
Or if you need some good therapists, these are the two that you can't go wrong. And we joke around because we've had some difficult patients or difficult cases that I've had the honor and privilege to be able to refer and work together and have them benefit significantly from all the things that you're able to offer them. So yeah, it's been good.
100%. All right, and thank you, and everyone have a good night.